Meeting to order, and I want to welcome everybody to meeting number 69 of the Standing Committee on Health, and we're here to discuss, examine, and act respecting cannabis and to amend the Controlled Drugs and Substances Act, the Criminal Code, and other acts. And I want to welcome all of our guests, and they will be, we will hear from them in the order, this order. The Honorable Jody Wilson-Raybould, Minister of Justice, will make a presentation first. Then the Honorable Jeanette Petitpas-Taylor will make a presentation as Minister of Health, and then when Mr. Goodale comes, the Honorable Ralph Goodale will make a presentation as Minister of Public Safety and Emergency Preparedness. From the Department of Health, we have back, by popular demand, Jacqueline Bogdan, Assistant Deputy Minister, Cannabis Legislation and Regulation Branch. And from the Department of Justice, again, we have Carol Morency, Director General and Senior General Counsel, Criminal Law and Policy Section. And from the Department of Public Safety and Emergency Preparedness, again, we have Trevor Pupsing, welcome back, Director General, Law Enforcement and Border Strategies Directorate. Now, I understand Mr. Goodale will be a little late, and so we're going to start in his absence, and perhaps, yes.
Mr. Chair, may I just clarify, will the ministers be here for the entire 2 hours of the meeting?
Will the ministers be here for the entire 2 hours?
Thank you.
Yes, that was a question I was asking. I wasn't saying. I was looking for a nod. But will the ministers, one? Okay, good. Okay, yes.
Thank you.
And Mr. Goodale will be a little bit late. But now, if we could ask the Honorable Jody Wilson-Raybould to start off with 10 minutes on cannabis.
Well, thank you, Mr. Chair, and thank you to the members of the committee. It is indeed a pleasure to be here, and I recognize that you came back early to have discussions and hear from witnesses on this most important topic that my honourable colleagues, Minister Goodale and Petitpas-Taylor, are pleased to present on C-45, the Cannabis Act. While the committee was doing its important work in terms of looking at this bill, Minister Goodale and I were meeting with our provincial and territorial counterparts in Vancouver. Cannabis and drug-impaired driving were both significant parts of our agenda. And we both feel that engagement with the provinces and territories is an incredibly important feature in our work to date. There can be no doubt that the legalization and strict regulation of cannabis has sparked much discussion, both before and particularly after the introduction of Bill C-45. In my remarks today, before I turn it over to my ministerial colleagues, I want to provide some background on the development of our legislative proposal, highlight the purpose of Bill C-45, and provide an overview of key justice aspects. There is a broad consensus among Canadians that our current approach to cannabis is not working. Our system of criminal prohibition fosters an environment where organized crime reaps billions of dollars in profits from its sale. Thousands of Canadians end up with criminal records for non-violent cannabis offenses each year, and cannabis is not being kept out of the hands of young people. Most Canadians no longer believe that simple possession for small amounts of cannabis should be subject to harsh criminal sanctions, which can have lifelong impacts for individuals and which takes up precious resources in our criminal justice system. Our government agrees that there is a better approach, one that is evidence-based and that will protect the health and safety of Canadians with a particular focus on protecting our young people. So as a starting point, we appointed a task force on cannabis legalization and regulation on June 30th of 2016, with a mandate to advise us on the design of a new regulatory system. I know that the chairperson, the Honourable Anne McClellan, and the task force's vice chair, Dr. Mark Ware, appeared before you as witnesses last week. Hello, Minister Goodale.
Hello.
As you heard, the task force conducted extensive consultations across the country, visited the states of Washington and Colorado, which have legalized cannabis for non-medical purposes, and considered nearly 30,000 online submissions sent in by Canadians. It also sought the views of diverse community of experts, professionals, advocates, frontline workers, youth professionals, Indigenous communities and organizations, territorial, provincial, and municipal officials, law enforcement, and citizens and employers. On December 13th of 2016, the task force delivered its final report, containing over 80 recommendations for the development of a Canadian legal cannabis framework. It reflects a public health approach aimed at reducing harm and promoting the health and safety of Canadians. The report has been very well received, is comprehensive, and provides important background information on the issues this bill seeks to address. It proved essential in developing Bill C-45. The bill paves the way for Canada to become the first G20 country to legalize and strictly regulate cannabis at the national level. It was introduced last spring alongside another important piece of legislation, Bill C-46, which proposes new and stronger laws to more seriously tackle drug and alcohol-impaired driving. As set out in Clause 7 of the bill, C-45, our government's intention is to protect public health and safety with a particular emphasis on protecting young people's health by restricting their access to cannabis, preventing advertising and other promotional activities that are likely to encourage cannabis use, providing for lawful production of cannabis to reduce illegal activities, deterring illegal cannabis-related activities through appropriate sanctions and enforcement measures, reducing the cannabis-related burden on the criminal justice system, providing Canadians with access to quality-controlled supply of cannabis, and enhancing public awareness of health risks associated with cannabis use. Bill C-45 creates a framework in which adults can access legal cannabis in an appropriate retail context that is sourced from a well-regulated industry or grown in limited amounts at home. Adults, 18 years or older, will be permitted to legally possess or share with other adults up to 30 grams of legal dried cannabis or its equivalent in other forms. Selling or possessing to do so will only be lawful if authorized under the Act. Under no circumstances will cannabis be sold or given to a young person. Production of cannabis will also require specific authorization. Possession, production, distribution, import, export, and sale outside this framework will all remain illegal and be subject to criminal penalties. These penalties will be proportionate to the seriousness of the offense, ranging from ticketing up to a maximum penalty of 14 years imprisonment. This graduated approach reflects the our legislative objectives. Bill C-45 will also exempt young persons from criminal prosecution who possess or share up to 5 grams of cannabis, rather than exposing them to the criminal justice system for what amounts to very small amounts of cannabis. Above 5 grams, young people will be subject to the Youth Criminal Justice Act, which emphasizes community-based responses, rehabilitation, and reintegration. For less serious offenses, alternatives to charging are encouraged, such as taking no further action, warning the young person, or referring them to a community program or agency to help address the circumstances underlying their behavior. Under Bill C-45, the federal, provincial, and territorial governments will all share in the responsibility for overseeing the new system. The federal government will oversee the production and manufacturing components of the cannabis framework and will set industry-wide rules and standards. Provinces and territories will be responsible for the distribution and sale. They will also be able to create further restrictions as they see fit, including increasing the minimum age to align with their legal drinking age. Further, the provinces and territories, along with municipalities, could create additional rules for growing cannabis at home, such as lowering the number of plants allowed per residence and restricting where cannabis can be consumed, such as in public places and vehicles. In addition to working with them to establish a secure supply chain, provinces and territories will be key partners in our government's efforts to raise public awareness about the risks associated with cannabis use. And as set out in Budget 2017, our government has provided $9.6 million for public education and awareness, as well as monitoring and surveillance activities. This includes monitoring patterns and perceptions around cannabis use amongst Canadians, especially youth, through the annual Canadian Cannabis Survey. This work will inform and refine further public education and awareness activities to mitigate the risks and the harms of use. I would now like to address some of the concerns that have been raised either during second reading debate or by witnesses appearing before you last week. I want to assure this committee that in developing the bill, we were aware of concerns voiced about the minimum age set, youth possession of small amounts of cannabis, personal cultivation, and the impact of our proposed legislation on youth. So let me start by saying that overall, Bill C-45 is informed by and closely aligns with the recommendations of the task force report recommendations. In terms of minimum age, our government has accepted the task force's advice that we need to strike a balance between the known risks of cannabis and the reality that Canadian youth and young adults currently use cannabis at some of the highest rates in the world. In striking this balance, Bill C-45 restricts the sale of cannabis to adults aged 18 and older. Provinces and territories will be able to set a higher minimum age, just like they do with alcohol and tobacco. In terms of exempting young persons from criminal prosecution who possess or share up to 5 grams of cannabis, we are aware of the criticism that this sends the wrong message to youth. Our government's position is clear. Young persons should not have access to any amount of cannabis. Under Bill C-45, there will be no legal means for a young person to purchase or acquire cannabis. Criticizing our government's decision not to criminalize youth for possessing or sharing very small amounts of cannabis ignores the evidence. Statistics clearly show high usage rates among youth, despite the fact that cannabis is currently a prohibited substance. Our government recognizes that for very small amounts, there is a better way to deal with young people than using the full force of the criminal law. Our government has been engaging with provinces and territories to encourage them to create administrative offenses to prohibit youth from possessing any amount of cannabis, similar to what is currently done with alcohol and tobacco. This measured approach would provide police with the authority to seize cannabis from youth with small amounts. Ontario has recently announced its intention to do just that, and I have been encouraging and urging other provinces and territories to follow suit. Most recently, just last week, at the FPT meeting in Vancouver. Another issue that was raised during second reading debate was the suggestion that home cultivation could mean greater access to cannabis for children. In response, I would note that the task force concluded that small amounts of cannabis for personal use can be safely and responsibly cultivated by adults in a manner that protects young persons in the home. Adults will be required to take appropriate precautions, as they must do now when storing prescription drugs, alcohol, and other potentially harmful substances. Additionally, the significant penalties proposed in Bill C-45 for selling and distributing to young persons, or for using or involving a young person in the commission of a cannabis offense, sends a strong message to any adults who would allow cannabis to get into the hands of children. In response to the other concerns raised, such as those related to the timing of implementation, challenges surrounding drug-impaired driving, and Canada's obligation under international drug treaties, I would like to emphasize that these are all issues that we continue to diligently work to address. We are continuing to work collaboratively with the provinces and territories, and as mentioned, Minister Goodale and I met with our counterparts last week. Ministers of Health, Finance, and Agriculture have also met to discuss the issue. In addition, federal officials will have maintained ongoing engagement with their counterparts. I see that the red card has been flagged for me, and Mr. Chairman, I will respect my time frame, and I very much look forward to questions, and I will turn it over to my colleague, Minister Petitpas-Taylor.
Well, I know as a Minister of Justice, you'd want to follow the rules, so.
Indeed, sir.
Okay, I want to welcome the Honourable Ralph Goodale to the table. Very good. Thanks for coming. But we're going to now go to the Honourable Jeanette Petitpas-Taylor, Minister of Health.
Thank you very much, Mr. Chair. And I'd also like to echo my colleague, Minister Wilson-Rayble's comments about thanking the committee members. I know that you guys were called in a week early last week, and you did a lot of work. So thank you so much for coming here and doing the good work that needs to be done regarding this legislation. So I'm honored to be here today with my colleagues, Minister Goodale and Minister Wilson-Raybould, to discuss Bill C-45, an act respecting cannabis, and to amend the Controlled Drugs and Substance Act, the Criminal Code, and other acts. I'd like to start off by acknowledging the remarkable progress on this file under the previous Minister of Health. It is because of her hard work and her tireless work of her staff and the staff of Health Canada that I am able to speak before you today. Protecting the health and safety of Canadians is a priority for our government and the focus of this bill. Canadians use cannabis at some of the highest rates in the world, and decades of criminal prohibition have not reduced these rates. In fact, cannabis has become the most commonly used illegal substance in Canada. Today, 21% of our youth and 30% of our young adults use cannabis. Our youth have the highest prevalence of cannabis use when compared to peers in other developed countries. This clearly shows that the current approach of cannabis is not working. This is why our government is proposing a public health approach to legalizing, strictly regulating, and restricting access to cannabis. Our aim is to minimize the harms associated with cannabis use, especially for youth. Scientific evidence shows that the risk for cannabis use are higher for youth than adults, that these risks increase the younger a person starts using it and increase further the more often that they use it. The legislation before us today, better known as Bill C-45, is the foundation of our government's new approach. Through this legislation, as well as early and sustained public education and awareness, we aim to delay the age at which youth are trying cannabis and inform all Canadians of the risk of using cannabis. Today, I would like to focus on three components of this approach. Number one, protecting youth. Number two, educating and public awareness. And finally, product safety and quality control. Let's start off talking about protecting youth. I would like to be very clear. In no way are we endorsing the use of cannabis or looking to make it easier for youth to access cannabis. Quite the opposite, actually. Protecting youth is at the center of our government's approach to regulating and restricting the use of cannabis. Youth are especially vulnerable to the effects of cannabis on brain development and function. Scientific evidence shows us that the younger someone is when they start using cannabis, and the more often they use it, the greater the risk to their health. As I've already mentioned, far too many young Canadians are already accessing cannabis. In many cases, it is easier for kids to buy cannabis than cigarettes or alcohol. The data supports this. In the 2015 Canadian Tobacco, Alcohol and Drug Survey, 21% of youth reported having used cannabis during the past year. Comparatively, 10% of youth reported using cigarettes. The striking difference in these statistics illustrate the power and effectiveness of a range of measures such as regulation, advertising, and promotion controls and public education, which over time have contributed to lower usage rates. Canada has been regulating tobacco and educating the public on the risks for the past 30 years. The percentage of youth who use tobacco has dropped from 27% in 1985 to 10% in 2015. This is why we seek to build on what we've learned by regulating tobacco. We will restrict youth access to cannabis by penalizing those who sell or give it to youth and restricting its advertising and promotion. Bill C-45 would prohibit anyone from selling or providing cannabis to any person under the age of 18 through provinces and territories, though provinces and territories could increase the minimum legal age of sale, purchase, and consumption. The proposed minimum age of 18 reflects the advice we received from the Expert Task Force on Cannabis Legalization and Regulation. It also balances the need to protect our children and youth from the adverse health effects of cannabis, while at the same time recognizing that setting the minimum age too high would risk preserving the illegal market, given the high rates of use among young adults between the ages of 20 and 24. Bill C-45 could create new criminal penalties for giving or selling cannabis to youth and using a youth to commit a cannabis-related offense. The bill would also prohibit certain products and marketing practices, especially those that would appeal to youth. Businesses would not be allowed to produce or sell cannabis products that might appeal to youth. Those marketing cannabis would also be prohibited from using any packaging or labeling that could be attractive to youth, including depictions of persons, celebrities, characters, or even animals. False, misleading, or deceptive advertising would be prohibited, as would sponsorships, testimonials, and endorsements of or any other form of promotion or branding that could entice young people to use cannabis. Promotion of cannabis would be permitted only if it presents factual information and is communicated in a way that could not be seen by youth. Also, cannabis could not be sold through self-service displays or vending machines. We believe that these safeguards will help keep cannabis out of the hands of our children and youth. The safeguards we are putting in place will help reduce youth access to cannabis, but we also know that youth today are less likely than adults to see cannabis use as a significant health risk. As someone who has spent my entire career as a frontline worker in areas of mental health and addictions, this doesn't surprise me, and I believe strongly that it is an issue that we must address. As with other drugs, while cannabis can be used therapeutically by some people, its use can also pose health risks. We need to provide Canadians with information about cannabis so that they can talk to their children about the risks. We must also educate and support adults in making informed and responsible choices that minimize risks, including the dangers related to drug-impaired driving. To this end, Budget 2017 directed an initial investment of $9.6 million to public education and awareness campaign to inform Canadians, particularly young people, about the risks of cannabis use. This campaign has begun and will continue over the next few years. The funds will also support an initiative to monitor trends and perceptions of cannabis use among Canadians, especially youth. This information will help inform our public education activities. The final aspect of our government's approach to cannabis that I would like to highlight is the product safety and quality requirements. The Act is designed to establish a legal and quality-controlled supply of cannabis available for sale in Canada. Under the proposed legislation and its regulations, our government would establish industry-wide rules on the types of products that would be allowed for sale. We would also have rules prohibiting the use of certain ingredients like nicotine, caffeine, and alcohol in cannabis products and require manufacturers to adhere to good production practices. The dedication and hard work that has been put into designing Canada's medical cannabis system means that we already have experience with product safety and quality requirements for cannabis. Our current system, which provides access to cannabis for medical purposes, is recognized as one of the best in the world. It includes a number of safety and security features, such as frequent inspections of production facilities and clear regulations around product testing, labeling, and pesticide use. We will be using this system of licensed production as a blueprint as we establish broader cannabis production under the bill. In conclusion, it's clear that the current system is not working. The legislation that is before you today is designed to address the issue that we are already facing. Our kids currently have access to cannabis, and organized crime continues to profit from the unregulated sale in our country. We are proposing a new way for Canada to address this problem using a public health approach. We all know that this is a far-reaching issue that stretches well beyond this particular piece of legislation. This issue demands that we cooperate across jurisdictions and sectors. Following the advice of the Task Force on Cannabis Legalization and Regulation, under this legislation, all levels of government would be able to establish certain requirements with respect to cannabis, consistent with their own jurisdictional authorities and experience. The involvement of the province and territorial governments is critical to ensuring that young people do not have access to cannabis. Under this bill, the federal government would be responsible for establishing and maintaining a comprehensive and consistent national framework to regulate production, set standards for health and safety, and establish criminal prohibitions. The province and territories could license and oversee the distribution of the sale of cannabis. Together with municipalities, they could also tailor certain rules in their own jurisdictions and enforce them through a range of tools such as tickets. We have worked closely with our provincial and territorial counterparts to ensure that their valuable input was taken into account from the beginning of this important effort, and our government is committed to continuing our ongoing collaboration with the provinces and territories on this very complex issue. With its focus on protecting youth, educating the public, and ensuring product safety and quality requirements, the bill uses a public health approach to strictly regulate and restrict access to cannabis. Our government is confident that the proposed Cannabis Act will protect the health and safety of Canadians. Thank you so much.
And thank you very much. And on behalf of all of the members of the committee, I want to congratulate you on your appointment as Minister of Health. And I'm sure that we'll all be engaged with you as we go forward on a number of issues. And certainly some of the most interesting issues are on the Hill are dealt with here at this committee. So again, congratulations. Now we go to the Honourable Ralph Goodale, Minister of Public Safety and Emergency Preparedness.
Mr. Chair, members of the committee, thank you very much. It's a pleasure to appear before you this evening. Thank you for the invitation. Glad to join my colleagues, the Minister of Justice, the Minister of Health, Parliamentary Secretary Blair, who has been front and centre in dealing with this issue over the last many months, and officials from our department. We're here, obviously, to discuss Bill C-45 and how this legislation will help keep cannabis out of the hands of Canadian children and profits out of the hands of criminals, certainly more effectively than the failed regime that has existed in this country for many, many decades. Au cours de l'élaboration de notre approche,
during the development of our cannabis approach, the strengthening of public safety has always been our main objective. I will therefore speak to you about our efforts to ensure that the organizations responsible for enforcing the Act, particularly police forces and border services, have the resources and training necessary for protecting Canadian communities.
it is important to be clear that Canada's current approach to cannabis, the one that's existed for decades, has simply not worked. The World Health Organization has studied cannabis use among youth in Europe and North America. In 2009-10, the WHO found that a third of young Canadians had tried cannabis by the age of 15, a higher rate than any other country in that study. And in a 2013-2014 study by the WHO, Canada remained in the top 5 for 15-year-olds and was number 1 in cannabis use among children 13 years of age or younger. As well, according to a 2016 statistical compilation by the United Nations Office on Drugs and Crime, the rate of cannabis use among Canadians 15 to 64 was almost 15%, and that was higher for that whole age span than every country except 2 others in the world. In other words, Canadians are among the heaviest and the youngest users of cannabis globally. There is clearly a need to do things differently, and that's why we've proposed this new regime based on the framework set out in Bill C-45, along with enhanced measures to combat impaired driving, which are contained in Bill C-46, and room for provinces and territories to tailor approaches that suit their particular circumstances. Essential to this new regime is engagement with and support for police and border officers to ensure that they have the tools that they need to enforce the law, To this end, we recently announced an investment of $274 million that includes $113.5 million over 5 years for the RCMP, the Canada Border Service Agency, and for programming within Public Safety Canada, primarily to keep organized crime out of this new legalized system and to combat smuggling. The investment also includes $161 million to train frontline officers to recognize the signs and symptoms of drug-impaired driving, to build law enforcement capacity across the country, to ensure that police have access to drug screening devices, to support research, and to enhance public awareness about the dangers of driving while impaired by drugs. Over half of this money, the $161 million that I mentioned, over half of that money will be accessible to provinces and territories over the next 5 years, and my department is already engaged with them to identify the needs and the priorities for the investments, particularly with respect to training and equipment. That collaboration across jurisdictions has been a key part of our preparations for the new legislative framework, and it will remain crucial to the implementation and ongoing evaluation of the system that Bill C-45 will put in place. In that regard, as the Minister of Justice mentioned, she and I spent 2 days last week with our provincial and territorial counterparts at a meeting in Vancouver where the discussions around this particular topic were particularly important. There are 3 topics that I would like to address of the many that will need to be discussed about Bill C-45, but 3 in particular that I'd like to address in a little more detail. First, on the subject of cannabis at the border. It is, of course, currently illegal to bring cannabis into Canada or to take cannabis out of Canada. Going both ways across the border, it's illegal. Under Bill C-45, that would not change. Border officers already examine people and goods entering the country to prevent the smuggling of contraband, including cannabis. They make use of advanced technology, intelligence gathering, and ongoing training about how to detect and interdict substances that may not be brought across the border. And their efforts will continue, bolstered by some of the new funding that I mentioned earlier. As for the admissibility into the United States of Canadians who have previously used cannabis, we have engaged our American counterparts to ensure that they understand how our new regime will function and what it will achieve. And we have made clear that we expect travelers heading in both directions to be treated in a fair, professional, and respectful manner. At the same time, the United States is, of course, entitled to make its own admissibility decisions. I would certainly encourage Canadians to be forthright with border officials and to keep in mind that cannabis remains illegal at the federal level in the United States. In fact, some of the new funding for CBSA will go toward communications and signage to ensure that travelers are well informed about the state of the law. The situation in the United States is also complicated by the fact that there are a number of state jurisdictions that either have already legalized cannabis or are planning to do so in the immediate future. So the situation with respect to American law is evolving. Second, on the subject of organized crime. At present, Canada's non-medical cannabis industry is entirely criminal. The illegal cannabis trade in this country puts $7 billion annually, perhaps more, into the pockets of organized crime. Over half of Canadian organized crime groups are suspected or known to be involved in the cannabis market. And Canadian law enforcement spends upwards of $2 billion every year trying to enforce what is currently an ineffective legal regime. With legalization and regulation, we can enable law enforcement resources to be used more effectively, and we can dramatically reduce the involvement of and the flow of money to organized crime. In Washington state, for example, legalization a short time ago has shrunk the criminal share of the cannabis market by nearly 75%. As with tobacco, we know that the black market is unlikely to be entirely eliminated, but we're talking about taking the criminal market share from non-medical cannabis down from 100%, where it exists today, to much, much lower levels. And that would be an improvement. And thirdly, on the subject of impaired driving, Parliament will have an opportunity, obviously, to go into this in much greater detail during the study of Bill C-46, the companion piece to C-45. C-46 is specifically aimed at better addressing the long-standing problem of driving while under the influence of alcohol or drugs. But I know it's an issue that touches many of us very directly, and I certainly feel a deep personal sense of urgency to tackle it head-on, both as Minister of Public Safety and as the Member of Parliament for Regina-Wascana. Of all the provinces, Saskatchewan has Canada's highest impaired driving rate. Among cities, Regina is third in the country, with Saskatoon not far behind. Too many families in Saskatchewan and in all of our communities mourn loved ones lost to impaired driving. This is therefore a problem that exists right now, and we would have to address it with or without the new cannabis regime, and it's urgent that we do so. As I have said, we are doing that with the legislation that we introduced in the spring, as well as with the additional cash investments that I mentioned a few moments ago. And I welcome the strong public support and advocacy that we see coming for legislation like Bill C-46 from such organizations as MAD, Mothers Against Drunk Driving. They have gone so far as to engage in a very public advertising campaign about the importance of this legislation. To deal with cannabis-impaired driving specifically, our approach focuses on educating the public and facilitating detection and prosecution. In March, for example, Public Safety Canada launched a social media campaign targeting young drivers and their parents in order to raise awareness about the dangers of driving while under the influence of cannabis. And last winter, 7 police services across the country, from Halifax to Vancouver and to Yellowknife, participated in a groundbreaking pilot project to study 2 different oral fluid drug screening devices in diverse operational settings, including the dead of winter. And as you can read in the report that was released in June, police generally found the devices easy to use in various weather, temperature, and lighting conditions, and part of the investment I mentioned earlier will help ensure that police officers in communities across the country have these devices and are properly trained to use them. Finally, on this point, I know this committee has heard concerns about the timeline for implementation. But cannabis-impaired driving is happening on our streets right now. The faster we get the right tools, the funding, the training, and the legislative and regulatory authorities in place, the safer Canadians will be. Legislative delay does not make the problem go away or get better. Delay only stalls more effective action. Public health and safety have been the key drivers of our approach to cannabis and will remain our overarching preoccupations. For too long, Canadians, and especially Canadian youth, have been using cannabis at world record rates to the great profit of criminals and organized crime. That needs to change, and that's why we have this bill before you now. Thank you, Mr. Chair.
And thank you. And I will now go to questions, and I think we'll have some good questions. We had over 100 witnesses in the last week, and they brought many, many different perspectives and opinions, and I'm sure they'll generate lots of questions. So we'll start our 7-minute round of questions with Mr. Oliver.
Great. Thank you very much, and thank you very much, ministers, for being here tonight and and answering our questions and making your statements. So as the chair has mentioned, we had 5 marathon days last week. We heard from over 100 witnesses. One night I think we even went to around 8 o'clock to make sure we fit everybody in. And what the benefit of that process was, we really got to hear themes because it's such a condensed testimony. We could hear the themes. So my questions are really just are going to be coming out of some of the themes. I won't be able to touch on all of them. The first one, Minister Pettipat-Taylor, was the very significant focus on the need for public education now, to get out ahead of the legalization. We heard that many youth really don't think there is a concern, that cannabis doesn't pose a threat to them. There's a lot of misinformation. So I know you have the $9.6 million fund. Congratulations on that. You're getting it launched, but could you maybe say a bit more about how that health education piece will roll out? When would I experience it in my riding of Oakville?
Thank you so much for the question. I guess first and foremost, I have to start off by saying that our government is committed to protecting the health and safety of children. And the $9.6 million investment that we've invested is an initial investment as well. We have to make that very clear. We recognize that we have learned through the task force and through different groups that we've consulted with that it's really, really important to make sure that the prevention and awareness is done before the actual legislation is passed, before that we roll this out. So as a result of that, the work in the public awareness and prevention has already started. I believe that last week you guys had heard from several groups that we've even partnered with. And one particular group, Jeunesse Sans Drogue, I believe they were here and showed you, the type of work, the tools that they've developed. These are the types of things that we're really pleased to see that have happened, and that we've seen that the feedback has been very good, and this tool has been well received by doctors, practitioners, parents, and the list goes on. The other thing as well, I think, though, that we have to recognize is that we also have to make sure that the public awareness campaigns get out to the youth, the people whom we're really targeting. And we recognize that perhaps in our generation, watching perhaps a hockey game on a Saturday night, we would invest in commercials. Well, probably that's not the best way to invest our money right now in targeting our youth. So we recognize that we were really going to have to focus on a social media campaign, and that's really what we're doing, investing on Facebook and Twitter and Instagram and whatever the case may be to make sure that we can get the messages to the kids. And finally, we want to continue to collaborate with provinces and territories to make sure that the public education campaign also can be done collaboratively and that we have access to all of the same information.
A second theme we heard Minister Wilson-Raybould was about the severity of the criminal penalties for those that are acting outside of the legalized or the legal permissions, I guess, that are in the Act. The example that really hit home for me was the height restrictions on home plants. So we heard from the task force that the 1 meter height restriction was not about preventing youth from accessing drugs or black market. It was simply the average fence of height bylaw was 4 feet, and they were concerned about neighbors and sympathetic to neighbors next to somebody growing their 4 plants. But in the Act, the penalties for over a meter, I think 1 meter to 1.5 meters, it's a ticketable offense, and anything over 1.5 meters is then criminal charges with penalties of up to 14 years. So that's the example of that hit home to me of could you maybe explain the 14 years and the severity of the penalties, and then maybe is there any room for softening on some of those that aren't really technically criminal charges, they're more municipal bylaw issues? So.
Well, thank you for the question, and thank you for hearing from the over 100 witnesses. In terms of the penalties from ticketing to 14 years, there is a broad spectrum of penalties, and the imposition of a ticketable offense up to 14 years will depend on the individual circumstances of the particular infraction or offense. And if we're specifically talking about the height of plants that can be produced or cultivated at home, I recognize what the task force has indicated in terms of the height of plants. from my understanding, plants can grow quite high, and the higher the plant, the more product the plant can provide, which is an indication that there might be an intention to divert some of that product to the illegal market. So it entirely depends on the circumstances in which an officer finds the plants in that circumstance, or any of the other offenses, whether or not it would be appropriate for a ticketable offense, depending on the possession amounts or the circumstances of another offense, if it would be up to 14 years. And there's obviously discretion that a judge would have in imposing a sentence. Likewise, there's discretion that a prosecutor would have, whether proceeding by way of summary conviction or indictment.
Great, thank you. And we heard from Mr. Goodell, we heard from an RCMP officer, I believe, who said that I think it would be naive to think that this act would make a difference in organized crime. You mentioned, I guess, could you tell us a bit more about the regulated market and how you perceive it cutting into the profits or deterring organized crime? Could you reflect on that for the committee?
Well, the objective, obviously, is to stop the flow of illegal cash to organized crime to the maximum extent possible. It's a $7 billion market, probably more, right now. The market is 100% controlled by organized crime at the moment. We can obviously do better than that. Can you totally eliminate it 100%? While that's the goal, it might be naive to think you could get rid of all of it. But I think we can put a substantial dent in it. And the experience in other jurisdictions, as in the state of Washington, would indicate that when you blunt the profit motive, when you have a strictly regulated regime, properly structured, and you take the profit motive out of it or substantially reduce it by changing the legal structure, you can reduce that flow of profit. And by the estimates in the state of Washington, they have accomplished a reduction of about 75% over the course of the last relatively short span of time. Our objective would be to do better than that, but the numbers from other jurisdictions would suggest that we can certainly anticipate considerable progress that would be much better than the state of affairs that exists today.
Time's up.
Okay, thank you very much.
Ms. Gladue.
Thank you, Chair, and thank you to all of the ministers for joining us tonight, and I especially want to congratulate the new Health Minister on her role. I'm looking forward to working with you to get good outcomes for Canadians. I'm going to start my questions with the Justice Minister. Everything that you've said, all of you actually, sounds very nice, but the reality of what's happening is a bit different. I mean, we had the Liberal members of this committee shut down our request, both NDP colleague and myself, to hear from young people, and maybe from Uruguay, the only other country that's legalized marijuana. And we heard testimony from the police that it will be impossible for them to be ready for the July 1st implementation date. Provinces, many of them have not come with a plan, and certainly not with legislation. And we heard from municipalities that they're not going to be ready for that implementation date. The Indigenous people said they're not going to be ready. And so if we consider that 88% of Canadians don't consume cannabis, and we have 283 days remaining until this arbitrary date, why are you in such a hurry to risk public harm? We haven't got testing in place with the police and training for impaired drug driving. The public awareness campaign that has been mentioned, we had 100,000 parents trained, and that's it. That's the only testimony received. So are you willing to consider pushing off the date until all of these stakeholders are ready?
Well, thank you for the question, and I mean, perhaps I can summarize some of the comments that we made in our opening remarks, and to quote my learned colleague, the current reality of the status quo in this country, as Minister Goodhill has said, has been an abysmal failure. We have the highest rates of cannabis use among young people in the country, and we are committed to ensuring that we do something about that as quickly and as appropriately and as efficiently as we can. We are committed to moving forward with legalization in July of 2018. And in doing so, we have taken an extremely comprehensive approach over the last 2 years to ensure that we introduce and continue to have conversations with all of our counterparts in the provinces and territories. Those conversations continued last week and will continue as we move forward towards July 2018. We engaged a substantive group of experts in terms of the task force report who, as I mentioned in my opening remarks, conducted extensive consultations across the country.
That's fine,
which
thank
we
you.
benefited from that.
I see you're going to stick to the date. And of course, we're presuming that people are smoking it now, whether it's legal or not. So we're assuming that legalization is the only solution to address the issue, which I'm not sure it is. My second question is for the health minister. We heard testimony that there's an increase of 30% in schizophrenia and psychotic disorders, depression, anxiety, and addiction in people who consume cannabis under the age of 25. We also heard discussion about home grow and the yields, as we talked about with the plants, could be up to 600 grams of cannabis in a dwelling with no requirements for potency quality control, no requirements for storage lockup, nothing to prevent parents from smoking up in front of their children. And we know from Washington's experience that home grow is where organized crime gets a foothold, and so they don't allow it, and the Canadian Police agreed. So why do you think it's in the best interests of young people's health to allow home grow?
Well, first of all, again, to echo what my colleagues have indicated, the evidence is clear that prohibition, the status quo, is just not working. So we truly have to make sure that we follow our plan. The objective of C45 is to legalize, strictly regulate, and to restrict access to cannabis to youth. That's really our priority in all this. And again, as you've indicated, we know that there's a high rate of usage when it comes to young Canadians. I just have a few quick numbers here. 21% of youth between the ages of 15 and 19 years of age consume cannabis. 30% of young Canadians between the ages of 20 and 24 years old consume cannabis. So we recognize that we have to have a regulated system in place because they're having access to unregulated products at this point, and we want to ensure that the products that they are going to consume, if they choose to consume, are going to be regulated. And once again, we are not encouraging youth to consume cannabis, but we want to make sure that it's safe and that we get it out of the hands of children.
Thank you. It's in their house. They're going to have a chance to get a hold of it. Question for the Minister of Public Safety. I'm going to follow up on a question that Mr. Mulcair asked in the House today. He was also talking about the border issue where when people try to cross the border and they're asked if they've smoked cannabis, that other than the Prime Minister, everybody else would not be allowed entrance into the U.S. You've said that that's the case and the U.S. has the ability to say, what's going to be legal in their country. Knowing that there's going to be a big problem, do you think there's a need to do some public awareness with youth that might want to work in the future in global roles? And with 283 days left, when is that going to happen?
There's a requirement and a very valid, important public policy objective to be served by making sure that all people understand what the legal or procedural consequences of their choices and their decisions are. As I mentioned in my remarks, one of the things that CBSA, the Canada Border Services Agency, will be trying to do is to make sure that people are well aware of the border implications of their behavior. We would not tolerate the Americans telling us what to do about our border. And similarly, we will leave the decision-making about American procedures to the Americans. That's their jurisdiction and their responsibility. What we can do is to make sure that Canadians are aware of the legal implications and the consequences. And we also will carry on a continuing dialogue with the United States to ensure that the treatment of Canadians at the border is fair and respectful. and professional, as we would have the right to expect as we approach their border, as they have the right to expect that kind of treatment when they approach our border. And I think it is important to note that the legal situation in the United States is complicated and evolving because state jurisdictions are going, in many cases, in exactly the opposite direction that the federal jurisdiction in the United States has chosen to adopt. So it will be a situation in the U.S. where I think you can expect an evolving legal environment, and one where we need to make sure as much as possible the Canadians are aware of what that environment is.
Thank you.
Mr. Davies.
Chair, and thank you to the ministers for being with us today. And again, I'd like to offer my congratulations to the Minister of Health on your appointment, and I look forward to working with you as well. My first question will be to the Minister of Health. The Task Force on Cannabis Legalization recommended that your government legalize and regulate edibles and concentrates. Here's what the Honourable Anne McClellan said last week when I asked her why the task force made that recommendation. Quote, "It's a growth area in the cannabis marketplace. Obviously, if you're concerned about public health, you want to move people away from smoking. If it's for medicinal purposes, there are therapies in non-smoking forms. As mentioned in the task force report, the edible market is growing. If you want to move from the illicit market into a regulated legal market, then you have to offer the quality and choice that the illicit market can provide. I think it's fair to say that we heard over and over again from a wide variety of people we talked to. There are public health reasons and public safety reasons why you would want to authorize or allow edibles in various forms," end quote. Minister, given that two of the most important purposes of this bill are to reduce illicit activities and provide access to quality controlled supply of cannabis, those are right in Section 7, why did your government ignore this recommendation? In other words, if prohibition doesn't work, as you said, why are you prohibiting edibles?
Well, thank you very much for the question, Mr. Davies. I guess, first of all, what I'd like to say is that our government has committed that by July of 2018, that we will ensure that Canadians have access to dry cannabis, fresh cannabis, and oils. From there, that is the beginning of the work that needs to be done. From there, however, we agree with the task force recommendations, but we'll have to bring in regulations to address the issue of edibles, and that is going to be done in due course. We recognize that with the experience in the States, they have extensive experience with respect to this, and most of their issues and complications really came out because of the issue of edibles. They weren't properly prepared to deal with it. So we want to really ensure that we have the proper regulatory framework that's in place to make sure that we have all the necessary tools that are in place to make sure that we get this right. When I look at edibles, we can see that there's a wide range of products that could be legalized. But if there's hundreds, if not thousands, of products that can be made legal, we have to make sure that we have the right regulatory process to get this done right. And that is why that we're moving with this process.
Thank you. Well, we did have Sam Kamen, who is a professor at the University of Denver, who told the committee that, quote, "I think our experience in the American experience is certainly that we have learned how to mitigate those risks." And he pointed to resealable packaging, non-transparent packaging, clear portion size, maximum THC per package, markings on the individual pieces, no marketing to children, etc., are all part of the state-of-the-art Colorado experience. And Minister, I'll just put you once again, leaving these products wholly unregulated means the risks of edibles and concentrates remains wholly unmitigated. Why is that better? Why are you content to leave those products to the black market and, as the Minister of Public Safety said, to organized crime, who probably are not selling their products in child-proof packages? Why are you content to leave that for another year or so instead of regulating them now, as Colorado has done very successfully?
Well, first and foremost, we want to make sure that we get this right. And as indicated, we are committed to bringing in the regulation that is needed regarding edibles. That is our commitment. However, we want to make sure that we use best practices. And again, we continue to consult with our neighbors down south. And they have told us loud and clear that if they had a choice, they would probably follow Canada's lead right now as opposed to how they did it.
Thank you. Mr. Goodale, to you about the border. Now, we know, I think we're all parliamentarians, we know that the United States is a sovereign country, and certainly nobody is asking anybody to tell the Americans what to do. The reality is that come July 1, 2018, if in fact that's the target date set, that there will be a new legal reality in this country. And we all know that there are stories of Canadians going to the U.S. border where U.S. border guards ask if someone has consumed cannabis. And if the answer is yes, they are routinely denied entry. So the question to you, sir, is are you working to try to reach an agreement with the Americans that recognizes the new legal reality, or will business people and ordinary Canadians simply have to try their luck when they get to the U.S. border on July 2nd?
We're constantly raising with the Americans the reality of the changing legal regime in Canada, one that we believe, on the basis of very compelling argument, will be more effective than the American regime, the American federal regime, in keeping cannabis out of the hands of kids and stopping the flow of illegal money to organized crime. That's an ongoing dialogue, and it's one that we will raise at every opportunity to ensure that Canadians are treated fairly.
Thank you. To the Justice Minister, C-45 retains a criminalized approach to cannabis in many respects, including possession limits, cultivation restrictions, and selling offences. Now, the Canadian Association of Chiefs of Police told this committee that, and I quote, "We know that there was in 2016 16 or 17,000 charges for simple possession of marijuana." There were actually more than that. But those will be replaced with ticketing. They'll be replaced with nuisance calls. They'll be replaced if, unfortunately, we go forward with personal grows, us having to manage those grow operations, which, of course, will be very time-consuming, and an onerous process for our officers who will then have to seize the plants, take them back to a police department or facility to store them. This is not to mention the new enforcement provisions around cannabis-impaired driving. We don't see this in any sort of time saving for our staff. Now, one of the purposes of the Act in Section 7 is to reduce the burden on the criminal justice system. So given that law enforcement agencies believe that the proposed framework will not reduce enforcement activities, and given that your government recently announced plans to spend an additional $274 million on cannabis enforcement, how exactly will Bill C-45 reduce the burden on the criminal justice system?
Well, thanks for the question. And I mean, in Section 7 of the Act, yes, we're looking to, one of the purposes to reduce the burden on the criminal justice system. We, in the Cannabis Act, have introduced a series of penalties that run the gamut or the spectrum in terms of from ticketing up to serious indictable offenses. And I recognize what you're saying the police officers have said. We are committed in terms of bringing in the Cannabis Act to ensure, one, as Minister Goodale spoke about, that we provide law enforcement officers with all of the necessary tools that they will require, from drug-impaired driving to other measures, to ensure that they can do their jobs appropriately. We're going to continue to work with our counterparts in the provinces and territories to provide them with the support that they need, as well as continue to work with municipal governments. I think that the spectrum from ticketing up to the realities of the more serious offenses that might result will contribute to a reduction in the use of court times, particularly where this involves younger people, where this involves the less serious charges between 30 and 50 grams of cannabis possession. There are alternatives than going through the regular criminal justice
Doesn't
system.
sound like it'll reduce the burden.
Time's up, Mr. Davies.
Thank you.
Thanks very much. And we go to Dr. Elson.
Thank you, ministers, all for coming. Now, Minister Goodale, I take to heart particularly what you say about how we need to address the criminal gang problem. I practiced emergency medicine in Winnipeg for almost 20 years and was intimately familiar as to why we were the murder capital of Canada. I quite frankly lost count of the number of bullet wounds and stab wounds I treated, the vast majority of those due to the illegal drug trade, and most of that being cannabis. So I thank you, and I appreciate the statistics that you were able to quote from Washington and Colorado about the market share that has gone down from the illegal market due to the legalization. Now, another big public safety issue, again, that I became intimately familiar with was impaired driving in all of its forms. Now, we know that, as you said, that this is something that's going on. This, legalization isn't going to create this. We know it's happening. Do we have any data right now as to the prevalence of people who today are driving impaired on cannabis? And I don't mean accident victims who simply the presence was found, but simply data on collisions and prevalence due to impaired driving due to cannabis.
I don't have those statistics right with me this evening, but if I could, this might be of interest to all members of the committee. I will ask my officials to prepare a summary of statistically what we do know at the present time of drug impaired versus alcohol impaired, and I would send that back to the committee just as soon as we're able to compile that arithmetic.
Okay, certainly. Thank you. Now, in Colorado, we heard testimony that what they thought was an apparent spike in cannabis-impaired driving was actually due to improved detection methods, as opposed to an increased actual incidence. Will this legislation and its provisions that are coming out of it in law enforcement, will they help to better detect and track impaired driving due to cannabis?
They will for two. The legislation, particularly Bill C-46, which is the companion piece, the legislation will assist in that regard in two ways. First of all, it will introduce new roadside screening equipment that will be more helpful in providing preliminary information about potential drug impairment, and then lead to more specific testing at the police station with blood samples. So the equipment will help for more accurate information, as well as greater training. Part of the money that I referred to in my remarks will go toward training more sobriety field testing officers who have the skill set necessary to identify situations at the roadside. At the moment, there are, roughly speaking, 3,500 of those officers properly trained across the country at various levels of police forces. Our objective is essentially to double that number over the course of the next 18 months to 2 years. And we're also aiming to increase substantially, by at least 50%, the number of drug recognition experts. These are people who are pre-qualified as experts in detecting drug-related issues and then testifying to that effect in court. There are now, roughly speaking, 500 of them in the country. We would want to see that number go up to at least 750, obviously distributed across the nation. So providing the better equipment and providing larger numbers of properly trained officers, either in the field or at headquarters in the police stations, that will certainly enable us to be more precise in future in respect of tracking the issue and quantifying the issue.
All right, thank you. Now, one of the other concerns that's brought up is regarding our provisions for allowing growing up to 4 plants in the home. I know we have a lot of assumptions on it. We don't know how common it's going to be. It is apparently a very difficult and labor-intensive plant to grow, or so I've heard. And but again, there's many assumptions. We had a member from one of the police departments say what would happen to a 200-unit apartment block if half the units had 4 plants. But when I asked him, what makes you think that you would see this, I got the response, and I quote, "I don't have the facts to back that up." That being said, do we have any idea as to, under the conditions we have, how big a problem this will be? or how common this will be? And do we have any federal legislation that would restrict how many plants you could grow if the owners of a multi-dwelling unit wanted to ban it? Like, is there a federal law that would say you can't grow this in apartment blocks?
Well, I mean, in terms of federal laws, I mean, there's we're going to continue to work with the provinces and territories, and particularly work with municipalities. There be an implication with respect to residential tenancy and all of the different interconnections with respect to different jurisdictions and different orders of government's laws. So we'll continue to work with our counterparts in that regard. In terms of the scenario that you talked about, an apartment building, this was discussed at great length by the task force, as you know, and the restriction of 4 plants was in part a recognition of having an overabundance of production of plants could lead to the concerns that are raised with major grow operations that happen in buildings. So restricting the number of plants prevents those negative consequences, certainly.
All right, thank you.
Time's up. That completes our 7-minute round of questions. And at this point, I'd just like to welcome, we have 2 new permanent members of our committee, and I'd just like to welcome them, Dave Van Kesteren from the Conservatives, and we have our new parliamentary secretary, Bill Blair, who's been with us quite a bit, but he's now a permanent non-voting member of the committee. We welcome you both and look forward to your contributions. So now we're going to go to 5-minute round of questions with Mr. Weber.
Thank you, Mr. Chair, and thank you, ministers, for being here today. Minister Wilson-Raybould, we heard testimony that from Dr. Stephen Hoffman, who is a professor of law at Osgoode Hall, and he is an expert in international law. And he is very concerned, as we are, the Conservative Party, that we don't break any international laws. And he proposes that this Bill C-45 legislation will in fact violate 3 UN treaties, the 1961 Single Convention on Narcotic Drugs, which is to limit exclusively to medical and scientific purposes the production, manufacture, export, import, distribution of, trade in, use, and possession of drugs. The 1971 UN Convention on Psychotropic Substances and the 1988 Convention Against Illicit Traffic in Narcotic Drugs and Psychotropic Substances, which is to establish as a criminal offense the purchase or cultivation of narcotic drugs or psychotropic substances for personal consumption. So these are 3 UN treaties that basically we will not be complying when this legislation passes. So I would just want to know what your government plans to do dealing with the other countries around the world who are a part of this treaty. Do you plan on just not complying and violating the treaties, or are you going to withdraw from the treaties? If in fact you do withdraw from the treaties, you have to give notice, and the deadline for notice for your proposed legislation of July 1st, 2017, in order for that to pass, the deadline is passed. So I just was wondering what your government is going to do about dealing with these international partners of ours.
Well, thank you for the question, and I am and my colleagues and I are working very closely with the Minister of Foreign Affairs. Thank you for speaking to the international conventions that we are signatory to. I'm very aware of the commitments that have been made with respect to those conventions. We're taking a substantive approach to legalization and strictly regulating cannabis in Canada. We've been very open with our international partners about our approach, and certainly taking a substantive health and safety approach as we move forward with legalization and strict regulation of cannabis. That health and safety approach is consistent with the goals and objectives of our international conventions. But we are going to ensure as we proceed, we will continue, as the Minister of Health, previous Minister of Health did at the United Nations, ensure that we're very open with the work that we're doing, the purposes of the work that we're doing, and the unique and purposeful approach that we're taking with respect to this bill, and going to continue to ensure that we maintain open and strong communications with our international partners.
Have you given official notice and indication that you will be withdrawing from these treaties?
As I said, I'm working very closely with our partners, with the Minister of Foreign Affairs, and have been very open with the approach that we're taking with respect to Bill C-45.
Could I also add that the United States has this evolving problem in terms of its international stance on various issues, because while at the federal level they maintain a prohibition, a number of states, including some with very large percentages of the population, are actually moving in the other direction. So there may well be a very significant international discussion involving a variety of countries around this issue in the months and years ahead.
Yes, Dr. Hoffman, Minister Goodale did bring up U.S. and the fact that some of the states are legalizing, of course, and have been, but it is a federal law not to legalize marijuana, and so that's how they get around this treaty, apparently. Any indication on Uruguay and the ramifications they have experienced from legalizing marijuana in their country?
Well, in terms of international relations and discussions with Uruguay?
Right. In terms of Uruguay breaking the treaty as well, they were part of the UN treaties as well, and now they've legalized marijuana. Are you aware of any ramifications or punishment that they've received from the international community?
Well, I would not endeavor to answer a question that is the domain of my counterpart, but I certainly will endeavor and commit to getting back to you after I have the opportunity to speak with the Minister of Foreign Affairs.
Good. Thank you.
Thank you.
Now, the clerk has alerted me to the fact that I overlooked Mr. McKinnon as a permanent member of the committee. He's been here quite a while, but now it's official. So I'd like to welcome him officially to the committee as well. So, Mr. McKinnon, I understand you're going to share your time with Ms. Seydoux.
Yes, thank you, Chair, and thank you for the welcome.
Welcome.
I feel
You're
like
welcome.
I've been here a long time. My question is for Minister Wilson-Raybould. So we know that youth who are found in possession of 5 grams of cannabis or more, and in various other ways, will engage the criminal justice system by means of the youth criminal justice system. It sounds kind of scary. And I know that their records will be sealed when they become adults, but I'm wondering if there's any other options open to us than to, that are non-criminal in nature that we could explore.
Well, we're, in terms of the 5 grams or less, continuing to, I think the criminal justice system should be scary to anybody, and wanting to avoid it at all costs. But we're continuing to explore. I'm continuing to have discussions with my counterparts in the provinces and territories to look at my colleagues, like Ontario announced last week, and putting in place or using legislation to restrict further cannabis possession among young people, providing police officers with the ability to seize cannabis that's in the possession of a young person, similar to what is currently done with alcohol. In terms of possession of a young person between 12 and 17, of course, as you mentioned, the Youth Criminal Justice Act applies, and that act invites rehabilitation and reintegration of young people into society. It looks at the maturity level of a young person, the dependency of a young person, and requires a police officer to look at alternative measures rather than putting, if it's appropriate in the circumstances, a warning or other measures for a young person so as not to have to proceed, if it's appropriate, through the criminal justice system.
Thank you, Minister. I defer to my colleague.
Thank you. Thank you, Chair. Thank you all the Minister for coming here. My questions to Minister of Justice. Clause 31, C-45 bill. It prohibits the sale of the cannabis or cannabis accessory, which is appealing to or attracting to youth. So who will determine whether that cannabis product or accessory which is appealing to youth? So does a designation or any designated minister will recall them, or can you explain that?
Sorry if I understand the question correctly. The Act provides, with respect to advertising, with respect to people promoting displays, this would be under the purview of
Yes.
the Minister of Health as described in many provisions within the Act. I don't know if my colleague wants to speak to that a little bit further.
Yes, certainly. C-45 proposes strict regulations on packaging and labeling and marketing and advertising. And we truly want to ensure that the marketing tools are not going to be enticing youth to want to consume cannabis. So very much as well, like we've done with the tobacco legislation and with the tobacco products, the same types of rules will apply with warnings on it and making sure that it's a very bland packaging, if I may say. Also, we are going to ensure that there's no sponsorships or endorsements when it comes to marketing. And finally, the only information that will be really available on the packaging is informational type of marketing information. Things like what is in the package, serving sizes, whatever the case may be. Those are the types of informations that would be available in the packaging. But again, we want to make sure that the advertising is not going to entice or encourage young people to use cannabis.
Okay, thank you. Do you have a time?
You have 42 seconds.
Okay, the next question is to Minister of Health. During the last meetings, we heard research on cannabis or its impact on health. We know that research is an important tool to help us inform decision made by individuals and by government. How will legalization of cannabis allow for more research? Is there any plan to do more research on that?
Thank you very much for the question, a very important question. Our government is completely committed to facilitating research when it comes to cannabis, with really two streams, the medical use and also the recreational use. The CIHR has actually put out a $1 million grant proposal specifically to do research in those two areas. So we are, again, looking forward to the findings. And also, as Minister of Health, when we look at research, if cannabis, when Bill C-45 becomes a reality, then from there it will be easier for the Minister of Health to actually approve these types of research because the product would be legal at the time.
Thank you.
Okay, thanks very much. And now we go to Mr. Van Kesteren.
Thank you, Chair. Thank you for being here. It's the first time I've had the opportunity to serve in this committee, and I think it's going to be a great committee to serve in. Question to the Health Minister. I'm surprised this hasn't been raised yet. Is this a healthy thing to do? Smoke marijuana?
As indicated, Bill C-45, in no way are we promoting
But answer the
people.
question. Is it a healthy thing to do?
With respect to the answer,
Compare it to cigarette smoking. Is it healthier than cigarette smoking?
I would not say that it's healthy. No, and again,
As a matter of fact, I think it's 5 times more
Yeah,
toxic.
yeah.
So
And-
I'm curious, do you have an end game? Like we obviously have recognized that cigarette smoking is not a good idea, and so the government has decided maybe the best thing to do is just tax it, really tax it heavy. And we've reduced our smoking significantly. Is there an end game with this legislation? Are we thinking about doing the same thing? Are we going to tax the product so that people will steer away from it because it's not good for them?
Bill C-45's objective is, again, very clear, is to legalize, strictly regulate, and to restrict access of cannabis from to restrict access to children.
I
That's
know that.
really what we want to do. With respect to the market as it is right now, we see that 100% of the profits are going to the black market. So by regulating our system, we truly want to make sure that people will have access to a safe product, and then from there getting the profits out of the hands of
But isn't that
criminals.
a double standard? I mean, we've determined that cigarette smoking is not good. I'm going to tell you a little story. I had the tobacco people come into my office one time, and they were really upset about the fact that the First Nations people were selling tobacco. And, you know, we got talking about that, and I said, you know, here's my problem. The government has taxed this to a point where it is now lucrative for organized crime. As a matter of fact, I don't know if people know this, but a bale of tobacco, I think at that time was $75,000. It was more lucrative to sell tobacco than it was marijuana. The tobacco company is selling a product that we know is harmful to their health, and the First Nations groups are selling this illegal. I said, I don't really know who the criminals are. So are we going to have an issue, and maybe I can direct this to somebody else, Mr. Goodall, maybe you can help me with this too. When if we have an end game, and I would really hope that we do, we're not going to make this cheaper and more of a product that's appeals to youth because it's cheaper. Are we going to then tax it so that we now have a new problem where maybe groups like First Nations groups say, you know what, this is entirely within our purview, we're going to start marketing this stuff. Have we thought about that? You can see where my line of questioning is going. There seems to be a whole lot of things you haven't thought about that you really maybe should.
Well, we've been guided in much of our analysis and deliberation by the extensive and very good work of the task force. The issue of pricing and taxation is a very serious issue that both the Minister of Finance and his provincial counterparts are seized with right at the very moment to determine what kind of fiscal regime will apply here to enable governments to defray the costs that are involved, but at the same time not create the very thing that you're worried about, and that is a black market. And therefore, the finance ministers have to deliberate very carefully about what fiscal rules will apply to cannabis in order to be sure that they are not inadvertently creating a black market, because that's exactly what we would not want to do.
I would suggest that we should have. I got a little more time, Mr. Chair? Wonderful. I share something with Mr. Blair in policing. I have 3 sons that are policemen, and I like to think sometimes I'm a little bit of a libertarian. And one time we just in the course of conversation we got talking about the legalization of marijuana. I said, you know what? I'm a libertarian. I think people want to smoke, let them smoke. I got to tell you, they came on me like white on rice. These are my police officer sons, and they said, Dad, you're out of your mind. And they started to list. Now, and I haven't got time to talk about the issues that they talked about. This is the police force. These are the people that are in the front line, and I have yet to meet anybody. And I'm sorry, Mr. Blair, with your exception, and I'm sure there are others. I haven't met them yet. How many police people in law enforcement that are just telling us, put the brakes on. You don't know what you're doing. You've got to understand there are implications here that we haven't dealt with yet. Why aren't you listening to those groups, and why don't we get a little bit of a sense of calmness from that group if you indeed have been dialoguing with them?
There are very serious implications of maintaining the status quo. The status quo has made Canadian teenagers the heaviest users of marijuana in the Western world.
But do we know why?
The status quo is putting $7 billion a year into the hands of organized crime. Delaying a solution is simply perpetuating the existing failure. We have to change from failure to a new regime that offers, in fact, some better prospect of success to protect our kids and to slow down and hopefully stop organized crime.
Thank you very much. Now we go to Mr. Ayoub.
Merci, Monsieur le Président.
Thank you, Mr. Chair. I'm very happy to have you here with us this evening to answer important questions. I would like to start, as I did last week, Test. This is the English channel. This is the English channel. 1, 2, 3. This is the English channel. This is the English channel. 1, 2, 3. I'll start again. It's no problem. What I wanted to say is simply that
Plugged into the wrong place.
Oh, yeah.
Now we've got it.
No problem.
What was I plugged into before?
Is it okay? Let's start again.
Thank you. I wanted to thank you. We're very lucky to have all three of you with us this evening to answer very important questions. I will start, as I did last week, by saying that we've waited long enough. There is urgency to take action. You said so yourself, Mr. Goodale. For a long time now, we've been using the system that doesn't work. We need to help our youth. And we heard from 130 people last week. We were given a lot of information, and 45% of youth in my riding have used marijuana in the last year. It's catastrophic, this situation. And even more so, we focused on the information and why these numbers are so high. There's an educational aspect, Ms. Petitpas-Taylor. I would say we need to update our education because, like for alcohol and cigarettes, there's a lot of education work that needs to be done. Parents, society, government have an impact on what young people consume or don't consume, and what is planned for on the educational side of things to raise the awareness of our youth so that they stop consuming marijuana at such a young age, and if they do choose to do so later, that they do so in full awareness of its effect. Thank you very much for the question. And first of all, the component of the awareness campaign is something that's a priority for us. As we learned from our neighbors in the U.S., they said that for them, they regretted that they hadn't done education campaigns before they unveiled their program. So for us, the $9.6 million investment is a beginning. We recognize that we need to undertake this awareness raising with our youth to talk about the consequences of marijuana, and we need to have an honest and frank conversation with them. We need to equip parents, we need to equip youth, and we need to ensure that they get the right information. We have struck partnerships with agencies that have developed tools, and once again, with respect to seeking out youth, we need to use the tools that they use, like social media, and we need to do different things for our awareness campaign. So we need to encourage dialogue with our youth. That's an important key factor. And we need to ensure that youth recognize the symptoms and the results of what they consume. I would strongly encourage you. I think that awareness raising is just a beginning. It requires money, and so I would encourage my government to invest more in awareness raising and in education. Mr. Goodale, with respect to the personal production side of things and plant cultivation, I see my colleague across the way was asking some questions about how we will counterbalance the legal production and do you think it will still be profitable for the illegal market because personal consumption of people consuming their own marijuana, they won't need to go to criminals as they do now. Our children and adults currently have to go to criminals to get cannabis. Is there a correlation to be drawn between this?
is really quite important and quite valid. Right now, the production and distribution is entirely in the hands of criminal organizations, 100%. Apart from the medicinal portion that has been carved out for a number of years by Health Canada. The objective is to remove from those criminal organizations the effective monopoly, to take away the profit incentive, and to establish a regulated production regime where we can have greater control over quality and the standards that would apply, and where the profits are earned legally and not illegally, and therefore achieve greater public health and safety as a consequence of that. Will the new regime be absolutely perfect and 100% successful? We hope so. That would certainly be our goal. But we can, under a new legal framework with strict regulation and control, we believe we'll be far more successful at public health and safety than the regime that has existed for 90-some years, which has obviously been an abject failure.
Time's up.
Yes.
And now we go back to Mr. Davies.
Thank you, Chair. Minister Goodale, Ontario's Liberal Premier Kathleen Wynne recently announced that her government plans to retail cannabis through a government-owned control board. Now, last week, the committee learned that the state of Colorado, in fact, any state, could not pursue such a model of public distribution because it would have put state employees in the position of breaking federal U.S. law by trafficking in cannabis. So, Minister, given that employees of the Cannabis Control Board of Ontario will be involved in the sale of cannabis, will this affect their admissibility to the United States, in your view?
No, because they have not violated any American law.
Minister of Justice, Michael Spratt, a lawyer, testified to this before this committee that Bill C-45
Indeed, let me just
leaves
say
intact
they have not violated any law, not just American law.
Well, not yet. Leaves intact the criminalization of cannabis in many circumstances that will harm vulnerable Canadians. I want to quote from his testimony. An adult who possesses 30 grams of marijuana in public is a criminal. A youth who possesses more than 5 grams of marijuana is a criminal. An 18-year-old who passes a joint to their 17-year-old friend is a criminal. An adult who grows 5 marijuana plants is a criminal. An adult who lets his 1-meter-tall marijuana plant grow an extra centimeter is a criminal. This continued criminalization is inconsistent with a rational and evidence-based criminal justice policy and will only serve to reduce some of the positive impacts of this bill. The asymmetrical criminalization of marijuana will only serve to perpetuate the disproportionate enforcement of laws on the young, the marginalized, and racialized members of our society. Minister, you know that Indigenous, racialized, and marginalized people are disproportionately represented in the criminal justice system and are disproportionately harmed by a criminal approach to drug laws. By maintaining a criminalized approach to cannabis, C-45 will perpetuate this discriminatory impact. Why have you done so?
Well, first of all, I mean, we are proceeding on a comprehensive review of the criminal justice system, targeting specifically to reduce the overrepresentation of Indigenous and marginalized individuals in the criminal justice system. What we've done with the proposed Cannabis Act and Bill C-45, as I said earlier in my comments, is to put a diversity of sanctions within the Act, from ticketing to the more serious criminal prosecutions that could arise. So there is an opportunity to proceed by way of ticketing for many of the offenses that you've mentioned, between 30 and 50 grams of possession for an adult. For youth, there's the opportunity, well, you go through the Criminal Justice Act, but there's also the opportunity to proceed in other manners that law enforcement officers
The question, Minister, though, with respect is, Do you not agree that this act will continue to have a disproportionate effect on racialized and Indigenous people?
The purpose of this act, as you've quite rightly pointed out, is in Section 7, and the purpose is to ensure that we legalize, strictly regulate, to keep cannabis out of the hands of young people and the proceeds out of the hands of criminals. We have an obligation, and I'm endeavoring to work extremely hard in the broader criminal justice system review to address the overrepresentation of Indigenous peoples and marginalized individuals, which has resulted from many factors.
Okay. After introducing Bill C-45, Prime Minister Trudeau told a Vice News town hall that, quote, "Our focus is on making sure we're changing the legislation to fix what's broken, a system that's hurting Canadians. And then we will take steps to look at what we can do for those people who have criminal records for something that will no longer be criminal." But Kathy Thompson, Assistant Deputy Minister for Community Safety and Countering Crime Branch in the Department of Public Safety, told this committee that, quote, "There are no plans at this time to introduce an automatic pardon as suggested, and there's zero in this bill to deal with pardons." Minister, can you confirm if your government is considering plans to pardon criminal records for offences that will no longer be offences when the proposed legislation comes into force?
We're examining the issue. We have not arrived at any conclusions yet, but obviously we're examining all of the options and all of the ramifications to achieve the objective that the Prime Minister referred to.
Thank you. Back to the Minister of Justice. The McClellan Task Force said Canada's governments and many other organizations will need to work quickly to prepare for the implementation of the new system, increasing our developing capacity in many areas relating to production, distribution, retail, quality control, enforcement, research, and surveillance. Having all elements in place will be necessary for the proper functioning of the regime. And they recommended that the federal government take a leadership role to ensure that capacity is developed among all levels of government prior to the start of the regulatory regime. But when asked if the federal government has been working with Indigenous governments on a nation-to-nation basis to develop that capacity, Ontario Regional Chief Isidore Day told this committee that, quote, "No, they haven't. The legislative process and the capacity and the mutually agreed upon processes as to how that's going to gel and work together to meet an outcome are going to be the challenge that is simply not happening with this government." Minister, given the task force's clear warning that intergovernmental cooperation is critical, and given the Prime Minister's repeated statements that his most important relationship is with Indigenous people, why has your government ignored First Nations governments in building the capacity for C-45 to become law?
Well, I would disagree with the statement that we've ignored Indigenous peoples, and we are firmly committed to engaging on a nation-to-nation relationship with Indigenous peoples right across this country. I know that Indigenous peoples and communities and organizations had the opportunity to speak with the task force in the production of their report. Likewise, I know that my colleagues and I will continue to engage with Indigenous communities as we proceed towards July of 2018. This is something that we are committed to doing and ensuring that we hear from as many Indigenous communities as we can. And this is a broader discussion around Indigenous governments and the ability of Indigenous communities, whether they're under the Indian Act or have self-government agreements. We're aware of the ability of Indigenous communities that are still living under the Indian Act to make bylaws around intoxicants on their reserves, as well as we are going to continue to understand and engage with Indigenous communities that have self-governed agreements and provide for their ability to move forward in this manner. And I know my colleague, Minister Pettypaw-Taylor, is continuing to engage with respect to the health aspects and the realities in Indigenous communities on an ongoing basis.
Thanks very much. Now, that brings to a close our normal round of questions, but I seem to detect a desire to continue to ask some more questions. So we're going to go to another first round, but we just barely have time. If everybody keeps their questions to 5 minutes, questions and answers, and I'm going to try to shut you down at 5 minutes without interfering too much. But so we're going to have one more round of 5-minute questions, and we're going to start with Mr. Ayoub. 5 minutes.
5 minutes. Merci.
Thank you, Mr. Chair. Yes, asking more questions and having more time for questions was always our objective, even when our colleagues on the other side of the table don't always fully participate in this. So I would just like to make a point about that. I would like to get back to the price and price per gram. We had all sorts of testimony that we're talking about 3.5 grams for $30. There was a medicinal price, the street price, price asked for by criminals. Does the government have a preference, or will it be up to provincial responsibility? Will it be left to a government organization or a private organization? How does the government see this happening in the various jurisdictions and provinces?
Other colleagues will want to participate in this as well. Retailing, under the framework that we're establishing, retailing is organized and managed at the provincial level. Obviously, if a province chooses the route of a Crown corporation in order to handle the retailing, the Crown corporation would play a decisive role in establishing price. Other provinces may have a different approach in mind in terms of how a market would be established and how market forces would determine pricing. The key role that government can and will play is on the fiscal side with respect to taxation. And I'm sure that the ministers of finance, federally, provincially, and at the territorial level, will want to ensure that the fiscal regime that they collectively agree to or agree with will accomplish the two fundamental objectives of the legislation. And that is to keep marijuana out of the hands of kids and to stop the flow of illegal cash to organized crime, which means eliminating the black market to the maximum extent that is humanly possible. They would not want to establish a price point that effectively perpetuates a black market. That's a fiscal decision that finance ministers will consider carefully.
Thank you very much. Thanks for sharing, Ramesh. I had a question. We invited most of the provinces and territories to present. We only heard from Saskatchewan, I believe, who said they weren't ready for this legislation. So in the event the bill becomes law, how, for remote communities, for Indigenous communities, Ontario and New Brunswick, I think, have some plans in place, but how will people be able to access this, or is the black market going to remain in place until the province and territory set their own rules in place for distribution and retail?
Well, we recognize that jurisdictions may be in different places in terms of their the work that they've done on this. If a jurisdiction, or a province, British Columbia as an example, is not ready when when we hope that Bill C-45 comes into law, then there is a backstop, and the federal government will provide a safe distribution from a licensed producer that can be securitized through the mail.
Okay. And if a province or territory if they haven't really addressed rural or Indigenous communities, remote communities, will that continue to be in place parallel to the provincial distribution, or will you cease to have a federal e-commerce model if
The chair has to leave. Certainly.
If I may, I guess perhaps just comment. The federal government's intention is not to play a long-term retail role in this. It's really short-term. But in the meantime, when provinces and territories, if they're just not prepared for the rollout, we will certainly ensure that process is in place for them. But it's a short-term.
Okay. And then last question was around plain packaging. So we know with cigarettes that there's a move to plain packaging. The bill as it's written does not move the sort of material for retail and distribution of cannabis to be plain packaging. It leaves it with color and branding opportunities. Do you have any thoughts about applying plain packaging regulations to the selling of cannabis?
Strict regulation is certainly our objective, and very much like the tobacco products, I can certainly see that we could go in that direction. We really, again, want to make sure that the packaging just doesn't entice kids to want to use cannabis, so that is certainly our intention moving forward.
Very much. Now we go to Ms. Gladue.
Thank you, Chair. A question to the Health Minister. With respect to growing marijuana in the home, in addition to the fact that that puts marijuana right where children can have access to it, there were a number of concerns that we heard testimony about. The fact that homes that have growing marijuana in them are 24 times more likely to have a fire. There's numerous incidents of electricity theft, complaints about odor, concerns about mold, and most concerning that in Ontario and Quebec, if you're a property owner and you are renting your property to somebody or had somebody renting your basement, you would not be able to prevent them from growing cannabis or consuming cannabis. And so when we look at who did this the best, we saw in the Washington model that they took their medical marijuana system that was very closely controlled and regulated, and they added in the recreational marijuana to that, and they only allowed a home grow for those that were medically fragile that couldn't get out to a dispensary. And as a result, they eliminated most of the black market. I think the statistic we heard was that 80% of what they're doing is legit. And so with that in mind, will the government consider eliminating home grow except in the cases of those that are medically fragile?
At this point in time, when we're talking about home grow, we have to keep in mind that we're talking about 4 plants. We're not talking about a grow op in a home here. The recommendation from the task force, we've looked at the recommendations very seriously, and the task force is also, making that recommendation. We will be moving forward, but we, again, looking forward to hearing from the recommendations of this committee. But again, I think that we have to give credit to Canadians as well when they're home. Canadians, I trust, will take the appropriate measures to ensure that this product is kept in a safe area, and that will certainly, in the best interest of their kids, keep it safe like they would with all other products. When we're at home and we've got alcohol, if we've got combustible products, we make sure that our kids are kept away from those types of products. And I see that with respect to this as well, that parents and most Canadians will certainly do the right thing.
I think that's naive, but when it comes to the public awareness and education training that is so important, we can see that in order to reduce the percent of drunk drivers on the road, there was a huge public awareness campaign that was done. And I think you were looking for statistics earlier. Out of traffic-related deaths, 18% had alcohol, 24% had drugs, and 16% had both. So it's definitely a concern. So with respect to the kind of campaigns that we need something like that. We need something that was like what was done with tobacco. You mentioned that the government has announced $9.5 million, but I think that's over 5 years. And if we look at what was done in Colorado and Washington, I think Washington said they spent $7 million a year for 7 million people, and Colorado 10 million, I believe, was the statistic for 5 million people. And so my concern is that there's not adequate funding applied, and with 283 days left, none of these awareness campaigns have begun to roll out. I mean, you mentioned Facebook and social media, but, I've not seen anything. If I've not seen anything and I've been looking, I'm just concerned that the 100,000 from the not-for-profit training for parents was the only thing that we really saw. So what is the plan to do some awareness to prevent the impaired drug driving increase we expect to see based on the Colorado and Washington experience?
Well, perhaps I'll start off and my colleague can jump in if he wishes. But again, as indicated, the $9.6 million is an initial investment when it comes to awareness and prevention. So that's key. Again, we've learned from other jurisdictions, they've told us that we have to start with the awareness campaign before the actual rollout, and that's exactly what we're doing. Being a former social worker, I can tell you awareness and prevention is key, and it's really important to get the proper information, especially out to youth. With respect to tools that are already out there, I think, again, as I've said, there's, this program is out there, the Drug-Free Kids program, but also there are the rollouts of the social media campaigns have already started, and we really want to make sure that we can ramp it up even more, because we want to make sure that people get the appropriate information that they need. As for the impaired driving, perhaps my colleague wants to jump in. Campaign?
Just to reemphasize that the campaign has begun. It is focused upon social media to start with, because all the statistics indicate that is by far the most effective mechanism to reach young people. So the work is ongoing, and it will undoubtedly accelerate, and it'll be complemented by the work of other organizations, including provincial governments, who in a number of cases have extensive information and educational campaigns in mind, both with respect to C-45 and the new regime dealing with cannabis, and especially C-46 that deals with impaired driving. And there are some very important private sector organizations like MAD, Mothers Against Drunk Driving, and the Canadian Automobile Association, who've already been very active in putting important messages, including paid advertising, in the public domain.
Thank you. If I just may quickly as well, that I forgot to mention, there is a working group as well that's been established with provinces and territories to coordinate the public education campaign. So again, working collaboratively with provinces and territories is key, and we appreciate their contribution.
Mr. Davies, 5 minutes.
Minister of Health, following your testimony that education and awareness is key, we received strong testimony about the importance of sound educational material about cannabis, effectively crafted to various target audiences. We heard one size does not fit all. When asked if the federal government has been working with the Assembly of First Nations or any other Indigenous organizations on developing targeted and culturally appropriate educational materials to roll out in advance of July 1 of next year, or if it has given Indigenous communities any money to do so, Ontario Regional Chief Isidore Day simply responded, no. Why isn't the federal government engaged in that work with Indigenous organizations?
Well, I guess first of all, I'd have to respond that we've certainly established working relationships with many groups in the community, and as you've indicated, one size certainly doesn't fit all. I would really have to get back to you to see the engagement with respect to our First Nations communities and our Indigenous communities, and I'd be more than happy to get back to you with a detailed response to see what the outreach that was done.
Minister of Justice, who will be responsible for enforcing Bill C-45 on reserved lands and banned land?
Well, the reality on reserve lands is that, I mean, there's an opportunity on reserves if the community is still under the Indian Act for communities to put in place a bylaw if they're desirous of having a dry community. It depends if they're still under the Indian Act or have a self-governing arrangement, what provisions or what agreements that they have made, whether that would be under provincial jurisdiction or whether there would have to be further discussions in terms of the RCM police. But where there are self-governing communities, there are agreements in many circumstances with provincial bodies.
Okay, last time I quote Chief Day, I promise, but he said that's one of the outstanding questions we have that is going to really determine whether we're ready or not. I have to tell you that most communities are very nervous right now about, in fact, not being able to enforce their own laws or even the federal provincial laws with respect to medical and recreational cannabis. I think it's highly irresponsible of the federal government to not be able to answer that question. So I would suggest that the federal government engage the First Nations a little bit more carefully on this, because there seems to be great confusion about who will be enforcing this law on banned lands.
If I could just respond, I mean, I really appreciate you bringing this up, and bringing it up I know Regional Chief Day and recognize that he is fully committed to wanting to move forward and rebuild governance, moving beyond the Indian Act. This is an opportunity that we all have across party lines to support Indigenous communities in rebuilding their institutions of government beyond the Indian Act. So the clarity that does not exist right now is clarified. So I call on you, my colleague across the way, and everybody to assist in rebuilding communities. That's what our Prime Minister is committed to, and that's what we're moving forward.
My last question will be that we've heard repeatedly that the market is 100% organized crime. Well, actually, the evidence is that it's actually not. We heard that from Dr. Neil Boyd, a criminologist from SFU, that a 2011 Department of Justice study found that 95% of cannabis trafficking offenders had no link to organized crime or street gangs whatsoever. And we heard other testimony that much of the people who are involved in the production and sale of marijuana are actually folks who are entrepreneurial, nonviolent, who actually have absolutely nothing to do with organized crime. And so the question I'm going to direct is about Section 62, which gives power to the minister to refuse an applicant for involvement in production on the basis of a prior cannabis conviction. Professor Boyd argued that involvement in the current illicit trade should not be sufficient to provide a bar to entry, particularly as we try to bring people into the light, from the illicit market into the licit market, unless they have a record of threats or violence or evidence of dishonesty or of some type. So, Minister, in the absence of these aggregating factors, do you believe that a prior cannabis conviction alone should be sufficient grounds to bar an individual for participating in the new legal market?
I'm going to turn this question over to my colleague, the Minister of Health, who has a comprehensive process in place in terms of what exactly you're talking about.
Answer.
And I'm going to defer it to Ms. Bogdan. How's that? So.
Ms. Bogdan, is there anybody else you'd like to defer the question to?
No. So, in answer to, thank you, Mr. Chair, for the question. In answer to the honourable member's question, as you know, I was here before the committee last week, and we discussed, the extensive requirements that we have in place for the existing system of production of cannabis for medical purposes. Which are, designed to ensure the integrity of the system and to ensure that it isn't infiltrated, by organized crime. The government will, set out what the requirements will be under the new legislation through the regulations, and is aware of those concerns and will take those into consideration. But I think it will want to continue to strike a balance that it does now to protect the integrity of the system.
Thank you.
Time's up. Okay, now we go to Mr. McKinnon. I understand you're going to share your time with Mr. Ayub.
Absolutely.
All right.
Mr. Chair, I'm going to have to leave. It's 8 o'clock, so I have somebody.
Okay.
Okay, well, I'm not going to ask you any questions then. Nothing personal, though. My question is for Minister Goodale.
She's watching the clock.
So you mentioned that import and export of cannabis is illegal. It will remain illegal. It occurs to me that with this new regime that we are putting in place, there will be a whole new source of cannabis in Canada. The legal, grow operations, as well as, I guess we should call them legal producers, as well as home personal cultivation and so forth. It would seem to me that this will create an opportunity for large-scale diversions to be exported to the United States, for example. So what are the challenges, I guess, that you see, that CBSA might see in relation to interdicting such activities going forward with the new regime?
Well, the law in respect of the border does not change. It is illegal now to import or export, and it will continue to be illegal to import or to export. And therefore, we will rely upon the very effective people who work for CBSA to make sure that the law is respected both ways. And they will use the technology that they have in place together with the general operations of enforcement that they have been very skilled at. Some of the money that we have announced will help them to augment their procedures and their resources to make sure that the border remains secure.
Do you see more of this, of legally grown cannabis being tried to be exported?
Somebody might try, but I would bet on CBSA being the winner in that contest.
Okay.
to make sure that the border remains secure. People should not underestimate the determination and the diligence of CBSA in cooperation with law enforcement generally in this country to make sure that the laws are properly respected. We put an enormous burden on our law enforcement officers and our border inspection and control officers to do their job, and they will do it well.
Great, thank you. That's my question.
All right, thank you. Minister Pettipas-Taylor, there was, this is the Task Force on Cannabis Legalization. They recommended a separate medical access framework from the non-medical market, for the recreational market. However, there was a recommendation from the Canadian Medical Association that this be evaluated within 5 years because there may not be a need for a separate system, medical and recreational. Do you anticipate that a separate system for medical cannabis would exist indefinitely, or could this be subject to review?
Well, we certainly recognize that we have really a quality worldwide service that's available right now when it comes to medical cannabis in this country. And certainly with respect to the legislation of Bill C-45, we can see that we can build on that existing service. With what's imperative, however, is that we want to make sure that consumers of medical cannabis will continue to have access to the product that they need. And we will continue as well to monitor that situation very closely to make sure that they always have access to the medication, to the products that they use. And I may ask Ms. Bogdan if there's anything else that you wanted to add to that.
Sure. I could just add, Minister, that yes, the government has committed that it will review, accepts the advice of the task force, and will review the framework in 5 years to determine whether the system should continue to exist.
Great. Thank you very much. I have no further questions.
All right. Well, thanks very much. Well, that completes our rounds of questions, and I want to thank everybody, and I want to thank the ministers for sure. But I want to make a comment. It's just my comment. I'm not speaking on behalf of the committee, but I don't have to because the committee has actually spoken. Every party here has talked about the need for education, and more education than perhaps is in. And the reason every party's talking about that is because almost every witness we had said the same thing. Public awareness education is really important. And I was thinking a minute ago, I saw things happen in this committee I've never seen before. We had witnesses come and say, I'm committing crimes at home. I committed crimes before I came. I'm going to commit them when I go back home. We even had one witness say, I committed a crime before I came in the committee this morning, and I'm going to, as soon as it's over, I'm going to commit another crime, and that's just smoke a joint. But I mean, that's how important the education is. But I'm pleased that all parties brought that issue up, because if there was one common theme from every witness, it was education and the need for early education. So anyway, look, thanks very much for taking the time to come and answer all our questions and stay overtime. Thanks very much, and thank you very much, committee. Meeting adjourned.